Good morning. It's a distinct honor to talk with you today with folks online from Australia to Israel to India and throughout the United States and Canada. You will hear today from some acclaimed experts on children's environmental and psychological health that cell phone radiation can and does produce damage to human cells by changing their shape and changing how they function. And this cell damage in turn translates to a real impact on children's well-being as well as their physical health over the long term, not just immediately, but over the long term. Today we have a very distinguished panel that will talk with you. Professor Hugh Taylor is the Chief of Obstetrics and Gynecology at Yale University Medical Center, a distinguished clinician and scientist. He's authored more than 400 scientific publications and will talk with you today about just one of these on prenatal impacts of cell phone radiation on adult animals. Martha Herbert is a pediatric neurologist, a clinician, and a scientist who has established a renowned clinic at Massachusetts General Hospital and is working at Harvard University, where she has leading efforts to come up with analyses of the total load impact on children's health from both chemicals and electromagnetic fields and radiation. Catherine Steiner-Adair is affiliated also with Harvard Medical School, and she is a clinical psychologist who will share with you her observations from studies of more than 1,000 children and their parents and the way that wireless radiation is changing parenting and childhood today around the world. Now, I talk to you today as a scientist and as a grandmother of 5 terrific children. Now, as a scientist, I can tell you we have a lot of uncertainty. There's no question about it. But we have enough knowledge that as a grandmother, I can tell you we cannot continue to experiment on our children without any controls. And the message that you'll hear from Professor Taylor at Yale, as well as from Dr. Herbert at Harvard and Dr. Steiner-Adair at Harvard, is that we can take some free and easy and simple precautions now to reduce exposures, and we should do that. We were pleased recently to see that Consumer Reports advised in their magazine in November that no one should keep a phone in their pocket. And that's what Environmental Health Trust, the organization that I head, has been urging since its founding in 2007. The reasons are simple. Phones are two-way microwave radios that receive and send microwave radiation that has never been tested for its long-term safety. We'll share here briefly the story of Tiffany France, who has stepped forward to talk about her struggles with breast cancer that she developed at the unusual age of 21, having no family history of the disease. She was not aware that today phones come with warnings that they're to be kept off the body. If those warnings had been available when she was a teenager, she would not have had her phone in her bra for more than 5 years, 12 hours a day. That is why the American Academy of Pediatrics has called for standards to be revised for exposure to radio frequency radiation, also known as microwave radiation, especially in light of such things as this, the iPotty. This is a real toy, so to speak, a real potty with a screen that will protect the iPad from the damage of the baby's dribble and drool. But of course, it doesn't protect the child from the radiation. Or this device, which I will show you in a moment, the virtual reality, which puts a two-way microwave radio directly in front of the brain of children as young as 6 or 7 and is being marketed now around the world with more than 1.5 million examples of this device handed out by the New York Times to all of its readers in a partnership with Google, featuring virtual reality segments every day, again, with no testing as to exposure, which I will be showing you. We know that exposure of this device gets all the way through the head of a child. According to our colleagues at Porto Alegre, Brazil, who are world leaders in modeling exposure. So where are we now? In fact, the city of Berkeley recently passed the right to know, and that law has been upheld by courts despite industry challenges. People have a right to know that within every cell phone there are warnings in the operating system or in the online manuals that say, keep it off the body. If that law had existed, then perhaps Tiffany France would not be struggling with more than 10 surgeries, starting with a double mastectomy at age 21. Her tumors occurred right under the antennas of her phones. Now, while that is anecdotal evidence, it's sufficiently powerful that her surgeon and her oncologist have published a report urging that pediatricians now have to advise their parents and their young patients not to keep phones directly on their body. Schools around the world are taking steps to reduce Wi-Fi. The city of Haifa has recently removed Wi-Fi from the schools. France has policies to have no Wi-Fi in kindergartens and with young children. In Belgium, it is against the law to design or give a phone to a child age 7. And the Korean government has issued warnings about digital dementia, which they are diagnosing in increasing numbers of children. The U.S. falls far behind in these efforts, and what we have to see now is concerted information established and shared with people around the world so that they will understand the risks of cell phone radiation, especially to the young developing brain and body, are real and they can be avoided. And that's what we're going to talk about today. And now I'm pleased to introduce my colleague, Dr. Hugh Taylor from Yale University Medical School. Let me share with you this thought. If Flint, Michigan has taught us anything at all, it is that the failure to prevent exposure has resulted in tremendous human costs and extraordinary financial costs to clean up afterwards. We cannot afford to treat our children like they're in an experiment without controls. Professor Taylor.